Hey guys, Kenan Omurtag here, another Lightboard series. This is the one a lot of patients may be interested in. This is the one on Asherman's syndrome. So Asherman syndrome is a condition in which the uterine cavity has scarring in it, simply put. There are varying levels of severity of the amount of scar that can develop in the uterine cavity. But I'm going to talk about Asherman syndrome and its varying levels of severity. So I'm going to talk in this series, this is the intro video. We're going to talk about, in this video, we're going to talk about what Asherman syndrome is, what scarring in the uterus is, the varying levels, what might cause it, how we diagnose it, and then in other videos we'll talk about treatment. Okay? So this can be a scary term for a lot of, it could be triggering for a lot of folks. It can be very intimidating. Scarring in the uterine cavity. First, let's talk about the uterine cavity. The uterine cavity is actually a potential space. When there's nothing inside the uterus, the walls of the cavity, if we look, this is a top-down view. If we look at a side view, here's a side view. This is a potential space where the top and the bottom touch, and what you really have is something that looks like this, a line. But what can happen is you can have infection, you can have scarring in here that can cause the potential space not to open. And that can be problematic if you're trying to have a pregnancy. So today we're just going to talk about what are the causes of scarring in the uterine cavity, because Asherman syndrome is scarring of cavity. And there, again, what's very important is that there are varying levels of the amount of scar. Asherman syndrome is a term that reflects the most severe type of scarring in the uterine cavity. You can have one scar band, you can have one adhesion band. When we talk about less severe versions of Asherman's, we might talk about uterine synechiae. You might hear us talk about one area that's blocked. Whereas, you know, if you just have a scar, if we go back to this picture here, if you just have a scar band here, that might be a synechiae. But if we look top down and you have an entire section of the uterine cavity that's obliterated because there's scarring in this area, and this whole area is like concrete in here, that would be Asherman syndrome, okay? Now, the most severe form of Asherman syndrome, which is the one that everyone fears, is the one where the entire cavity is obliterated. And if the entire cavity is obliterated, the uterine cavity cannot A, build a lining, and B, can't shed a lining, and C, if that's the case, then there's no viable tissue for implantation and pregnancy to occur. And severe forms of Asherman syndrome, you can surgically correct them, and I'll talk about that. And sometimes you can't, and that's what's scary. When this term comes up for patients, there's a fear that, oh my gosh, I'm never going to be able to carry a pregnancy again, and I might need to use a gestational carrier. If it can't be corrected. So in order to understand how Asherman syndrome occurs, we have to understand the causes and then understand essentially why the lining scars. And that's what we'll talk about in a subsequent video.